since 5 days, and we have also discussed on the importance of fieldwork practicum and the relationship between fieldwork practicum and the theory. And I'm sure most of you have joined some fieldwork organizations. It included senior citizens, children, or any other welfare organizations, youth organizations, or any other organization per se. There are a lot of other techniques as well. We have discussed various techniques, the limitations, the objectives of second semester fieldwork practicum. We also discussed various issues to be addressed in different countries of Africa. It could be rural, urban population, semi-urban population, women population, children, health sector, education sector. So far we had almost 4 presentations. Today is the 5th and 6th group are going to present. Now I request group number 5, Mr. Ishaq and Umar. They are going to discuss on reasons for poverty and health issues in Africa. So once we will cover this topic, we will also discuss how best the field work can be done there. Through that, you can also utilize group work and casework methods to resolve some issues probably wherever you are practicing. So we'll also discuss what are the social work techniques and the objectives can be utilized. As I said in the beginning, the motto of social work is helping the people, helping to themselves. That means directly you are not giving some aids or some money or some things to their problems, but you are teaching them some skills. It could be counseling skill, it could be resource mobilization skill, it could be some other problem solving skill, so that they can learn their techniques and resolve their issues in their life. So it's nothing but helping the people to help themselves. So now I request group number 5 members to present their topic one by one, and I also request other members to take down the your clarifications or questions if you have regarding the topic, and at the end of this presentation we can clarify. Is that fine?
Yes, sir.
Yeah. So are there group number 5 members?
Yes, sir. Good morning, sir.
All right, sir. Yes, sir.
Yeah. So Mr. Umar is there. Umar, you are the leader of group number 5. The topic
Yes,
already I
sir.
have
Good morning.
mentioned. Yeah. So can you start?
Sir, Rashida will take first because he's having an exam 10:30.
No issue. No issue. Yeah. So whoever
All
is
right,
there, so
when
they can
Rashida.
they can go ahead.
All right, Rashida.
Thank you, Umar. Good morning, everyone. Good day. My name is Rashida Olanike, and I'm so sorry for taking this chance. I have to quickly do this because I have an exam. So sorry, sir. Sorry, doctor.
No issue. No issue.
I'll be leaving the class early. Thank you, sir. So my name is Rashida Olanike Ahmed from Nigeria, and I will be presenting on the meaning of poverty in Africa. So poverty refers to the state of condition in which people or communities lack the financial resources and essentials for a minimum standard of living. Poverty can also mean lacking a particular aspect of one's needs, deprivation of rights, or malnutrition. Poverty in Africa is very common and something almost everyone would have experienced one way or the other. It may be through loss of job, it may be through a divorce, even a health crisis can cause one to be economically unstable. So we've seen a lot of families who experience lot of loss, poverty, experienced poverty during the pandemic, the COVID-19 pandemic, especially families who are in the service or in the tourist industries. There are so many families that are living on paycheck to paycheck, and we're unable to cater for their basic needs. So we have different examples of poverty, which are like malnutrition can be a result of poverty. We have malnutrition, that is being unable to feed well, especially on balanced diet. Illiteracy is also a form of poverty, that is poverty of education, lacking basic education. Social poverty, like deprivation of basic rights, lack of social amenities, which is the most common of all. That is this very, very common in African countries, lacking good roads, quality electricity, adequate health care, safe drinking waters, and the likes. So this is what I'll be presenting on the meaning of poverty, while others will take. Thank you, everyone. Thank you, Doctor. Thank you, my colleagues in Group 5, for working jointly to present this. Thank you very much.
Thank you so much.
Hello, good morning, good afternoon, everyone. This is Namju Rahma in Group 5. I'm going to be taking you through the types of poverty in Africa. There are mostly 6 types of poverty in Africa. We have the absolute poverty. This is where someone fails to get even the basic needs of life, water, shelter, and food. The second one is generational poverty. This is a poverty that is experienced through a family that has been through poverty for over 2 generations. And the third one is situational poverty. This is poverty of situations. For example, people were very poor during Corona virus period. That is the situational poverty. It's not a permanent poverty, as to say. There is rural poverty. That is poverty experienced by the people in the villages, people that do stay in villages. That is the rural poverty. Then relative poverty. This is kind of poverty compared to the general income of the area. And lastly is urban poverty. This is another type of poverty that is experienced by the people living in urban areas. I think I'm through with my types of poverty that I had to present. Thank you, everyone, for listening to me. Invite another person to take over. Thank you.
Good morning, Doc, and my fellow intellectuals. My name is Wilson Chwoya from Zambia. I'll be taking up the part for reasons of poverty in African countries and possible solutions. So when it comes to poverty, I can say poverty and health issues are intertwined and a significant challenge facing the African population. And some of the reasons why poverty and health issues persist in Africa are economical factors, whereby a significant cause of poverty in Africa is the low economic development and unequal distribution of resources. This usually leads to limited access to education, health care, and basic amenities like clean water and sanitation. Lack of access to health care in turn contributes to the prevalence of infectious diseases like HIV and AIDS, tuberculosis, and malaria. The other reason is political factors. Instability and conflict in some parts of Africa create an unfavorable environment for economic development and access to health care. War, corruption, and weak governance result in limited access to essential services and resources, as well as destruction of infrastructure. The other reason is environmental factors. Climate change, natural disasters, and environmental degradation contribute to poverty and health issues. These factors lead to the loss of livelihoods, displacement of populations, and limited access to resources. The other reason is cultural factors. Cultural beliefs and practices can have a significant impact on health outcomes in Africa. For instance, harmful cultural practices like female genital mutilation and early marriage contribute to maternal and child health problems. These cultural practices often perpetuate poverty and health issues in Africa. The other reason is limited access to education. Limited access to education perpetuates poverty and contributes to health issues. Education is an essential tool for improving economic development and access to healthcare, which in turn promotes good health outcomes. The other reason is lack of access to healthcare. Lack of access to quality healthcare is a significant contributor to poor health outcomes in Africa. Limited access to essential medicines, trained health personnel, and modern health facilities makes it difficult to address health challenges and prevent illness. Then looking at the possible solutions to poverty in Africa, in most countries in Africa, I think the first thing we can look at is education, whereby investing in education can improve literacy rates, which in turn can lead to better job prospects and increased income. Education can also provide people with the skills and knowledge necessary to start and run a business. The other possible solution is economic growth. African countries can achieve economic growth by investing in infrastructure, increasing foreign investment, and promoting exports. A growing economy can create jobs and increase incomes, which can help reduce poverty. The other possible solution is access to credit. Providing access to credit can enable people to start and expand businesses. Microfinance programs can be an effective way to provide credit to small business owners who might not otherwise have access to financing. The other possible solution is agriculture. Agriculture is a major source of income for many people in African countries. Investing in agriculture can increase productivity and incomes and help reduce poverty. Then healthcare. Providing access to healthcare can improve the health of people living in poverty, which can enable them to work and increase their incomes. It can also reduce healthcare costs, which can free up resources for other anti-poverty programs. The other possible solution is social safety nets. Social safety nets such as cash transfers or food assistance programs can provide a safety net for those living in extreme poverty. These programs can help reduce poverty and improve the well-being of those who are most vulnerable. Last but not the least is empowering women. Gender inequality is a major barrier to reducing poverty in Africa. Empowering women through education, training, and equal access to resources can help reduce poverty and promote economic growth. Then in conclusion, I can say reducing poverty in Africa requires a multifaceted approach that addresses economic, social, and political factors. By investing in education, economic growth, agriculture, healthcare, social safety nets, and gender equality, African countries can help reduce poverty and improve the well-being of their citizens. That's all. Sure, my next colleague will take it up from where I've left. Thank you.
Thank you. Next presenter from group number 5. Hello, am I audible?
Yes, you are audible,
Yes,
sir.
sir. Yes, yes. Hello.
Hello. My name is My name is Shuaib Isaac from Nigeria.
Yeah, please go ahead.
No, I am in
Is it you,
group
Wilson?
5.
Wilson?
I will presenting what is the meaning of health. The meaning of health and its promotion. The Constitution of the World Health Organization, which came into force on 7 April 1948, defined health as a state of complete physical, mental, and social well-being. The writers of the Constitution were clearly aware of the tendency of seeing health as a state dependent on the presence or absence of disease. So they added to that definition that an individual, if he is to be considered healthy, should not suffer from any disease, and not merely the absence of disease or infirmity. In that way, the definition of the definition of the World Health position that allow to declare someone healthy if no disease could be found. The step forward that could have been taken in the conceptualization of health as a dimension of existence which can exist with the presence of a disease or impairment was thus not taken. Today, three types of definition of health seem to be possible and are used. The first is that health is the absence of any disease or infirmity. The second is that health is a state that allows the individual to adequately cope with all demands of daily life, implying also the absence of disease and impairment. The third definition states that health is a state of balance and equilibrium that individual has established within himself and between himself and his social and physical environment. The consequences of the adopting one or another of three definitions are considerable if health is defined as the absence of disease. The medical profession is one that can declare an individual healthy. With the progress of medicine, individuals who are declared healthy today may be found to be diseased tomorrow because more advanced methods of investigation might find signs of a disease that was not diagnosable earlier. How an individual feels about his or her state is not relevant in this paradigm of health. How the surrounding people judge the behavior and appearance of an individual is only relevant if their observations are congruent with the criteria of abnormality that the medical profession has perceived. The measurement of the state of health of a population is also simple and will involve no more than counting the individual who, on examination, show defined signs of illness and, and comparing their numbers with those who do not. There are obvious difficulties with the first and the second of the definition mentioned above and with their consequences. There are individuals who have abnormalities that can be counted as symptoms of disease but do not feel ill. There are others whose body issues do not demonstrate change but who feel ill and do not function well. There are people who hear voice and might therefore be candidates for physician examination and possibly treatment, but live well in their community. and do not ask for nor receive medical care. There is a significant number of people who have peptic ulcer and other disease experience no problem, do not know that have a disease and do not seek treatment for it. Some of these individuals will also escape the second type of definition of health because they function as well as expected in their age and gender group of the general population. The third definition mentioned above make health depend on whether a person has established a state of balance within oneself and with the environment. This means that those with a disease or infirmity will consider it as being healthy to a level defined by their ability to establish internal equilibrium that makes them get the most they can from their life despite and presence of disease. Health will thus be a dimension of human existence that remains existence regardless of the presence of disease. So this is end my presentation, sir.
Thank you, Mr. Ishaq. So, is there any other person from group number 5?
Yeah.
Yes, we
Yeah,
still have
please
3
go ahead
people
one by
left,
one.
sir.
And request others to take down the questions so that you can ask
Hello?
at the end of the presentation.
Hello.
Go ahead.
Hello.
Hello, sir. Hello, sir.
Yes, please go ahead.
Yeah, I am Tandizo Nyaka from Malawi, and I am going to present about examples of health problems in Africa. Globally, countries are facing health system problems, which vary from one country to the other, but my presentation will mainly concentrate on African countries, especially healthcare systems in Africa. We have over the years, suffered from man-made issues, which cut across the institutional, human resource, financial, technical, and political problems. With this in mind, I'm going to describe healthcare systems in terms of the following core components. Firstly, there is a lack of access to safe water supply and inadequate sanitation facilities. Facilities causes diarrheal diseases in most of the developing countries. Diarrhea, as you know, it causes a lot of death, mostly among the youth. For example, in my country, access of safe water drink and sanitation. Running water at household level is very rare, and most Malayans have to make a daily trip to a community borehole or wells, rivers, or lake. And secondly, high infant and child mortality and maternal rate. This mortality rate here in Malawi, example, there is a high rate of infant and maternal mortality. This one is one of the problems which African countries face. In Africa, some women, example, give birth at home. On the job, and it is extremely common for which should also. And number 3 is about malnutrition. Malnutrition is one of the major health problems facing Africa, and is one of the leading causes of death among Africans. So malnutrition, as it is concerned, is defined as a condition which is caused not just by a lack of food, but by taking a diet which is so unbalanced that the body lacks certain nutrients altogether. So while other nutrients may be excess, causing nutrition disorders, which are not only harmful, but are potential factors. So World Health Organization cites nutrition as a single and greatest threat towards public health. Number 4, I'm also looking at the spread of infectious diseases, including HIV, AIDS, and tuberculosis. Infectious diseases such as HIV and AIDS and tuberculosis are also major challenges to be overcome by developing countries. Finally, developmental and reproductive health indicators in African countries are still terrible. Hence, health consequences have been linked to poor socioeconomic growth and development. So, I thank you all for listening attentively, and I would also like to thank Group 5 for giving me support in my presentation.
Good morning, sir.
Yeah, good morning. Please go ahead.
I'm the next speaker. I'm here to talk about the health issues in Africa. There are several health issues here. We have health disease and strokes, HIV, motorcycles injury, nutrition and physical and obesity, prescription and drug overdose, teen pregnancy, tobacco use, food safety, alcohol-related harms. Because of time factors, I'm going to talk about 3 to 4 health issues. Food safety. Food-borne illness sickness, one in 6 African each year, and result of 3,000 deaths. The U.S. Department of Agriculture calculated the cost of foodborne illness in Africa as $15.6 billion annually. However, foodborne illness is preventable, and CDS USD take leading role in promoting food safety at federal level. Then we have heart disease and stroke. Both heart disease and stroke are leading cause of death in Africa. About 610 people die of heart disease each year. Prevent of focus addresses high blood pressure, cholera, and smoking. Meanwhile, HIV. The number of new HIV diagnoses inclining, but about 44,000 people are diagnosed with HIV in 2016. In total of approximately 1.2 million Africans are living with HIV, and about 13% do not know they are affected. Nearly 7,000 people per year die from HIV and AIDS. Educating the population about way of preventing HIV infection and distance to correct use of condom to use sharing needles and continue to be important. I'll hereby stop here and thank everyone for allowing me to present. Thank you very much, sir.
Thank you. Is there any other person from group number 5?
Yes, the last person is here.
Yeah, please go ahead.
My name is Stephen Chung. My name is Stephen Chunga, from Malawi. Could be dealt with, especially in the health sector. I will not explain much because of time. I understand the group 6 would also want to come in. Yeah, the first thing that can be done is the promoting healthy awareness. Because it seems in Africa we've got a problem where most rural people do not take the health issues seriously, and they need people who are health personnel to go into those areas to simply make sure that these people are aware of the health issues in their area. Secondly, the countries are supposed to update their health systems in Africa, where they can promote intersector collaboration between the public and the private partnership in dealing with the health issues. For example, HIV and the coronavirus. These people worked tirelessly together to deal with this particular problem. Thirdly, this can be dealt with by preventing brain drain. Brain drain, we are talking of most educated Africans. They usually go outside the African continent to work in diaspora, where mostly they are regarded as the best doctors, the best nurses, the best health personnel. If we can prevent the brain drain, it means Africa shall have the personnel who are well educated, who are well aware of the health issues, and they can easily deal with these issues without problems, as long as they are provided with the better infrastructure.
Hi.
Yeah, please go ahead. So group number 5 is over, right? Hello.
Hello, sir.
Yeah, group number 5 is over, right?
I think for group
The
number
network
5,
of
we are
skipping
done.
Yeah,
is
so
not
we will,
good. That's
yeah, we will take questions now on the health issues of African continent in different countries on group number 5 topic. Are there any questions from the floor, or shall I ask? Yeah, please go ahead.
My name is Faisal Abdullah Mato from Nigeria. My question considering toward the group 5 is about the HIV/AIDS. Sir,
Yeah,
what
yeah,
are
go
the
ahead.
procedures? What are the procedures that we can eradicate ourselves in HIV/AIDS?
See, let me answer this. As a social work professional, I want to teach you social work interventions, social work actions. The eradicating is a not a simple terminology. It is, it is a very big, the area. But as far as the interventions are concerned for HIV eradication, HIV/AIDS, you may be knowing, and many people might have worked in that area, or you might have read, or you might have seen different, organizations how to eradicate. There are many ways. One is, the first thing is the knowledge, awareness has to be spreaded across the society, isn't it? The awareness on HIV symptoms and its root causes, are the transmission of HIV, and its negative impact on health, family, society, stigma. All those things need to be dealt in systematic manner. The first thing is, as you are a social work trainee, wherever you are working, the awareness, right awareness on HIV and its related aspects has to be spreaded to all the people, not necessarily for only adult. It has to be given. So what is the root cause, and that means how this HIV will be transmitted from one person to another person, from different modes are there, different ways are there. So the right information has to be given. That is one. Second one, those who are already infected, for them there are medical interventions. It is called ART, antiretroviral therapy is there, that has to be given the best on their health parameters. And second one, you also need to be, you need to give counseling as well through group work, individual case work, the counseling can be given so that they can also, psychologically they can fight with the problem and affect, that is infected people, and affected people means their family members, those who are not directly infected, affected. One of the family member may be affected, so infected with their, their family members also required counseling, also required social work intervention. So you can do that. Another, community has to be, you need to give intervention to community as well. Community also need to understand when there is a health issue, severe health issue, so how we can help the people with infected and affected. So how best we can prevent this. A lot of other health issues. So this is one thing. But as a social worker, you can, you may be finding a number of agencies working with HIV, AIDS population, the family members. You can work with them. You can sensitize the issue in the society. You can go to different schools, colleges, different organizations, sensitize the impact of, this particular illness. How best you can, prevent in the society. Work with the affected population. That is also there. And probably support group meetings are very important. So you can use social group work method here. They need support from health workers, social workers, and society family members. That is another important area. Yeah, you will get a number of interventions. It's all available in the net, and you can download, or you can also contact nearby HIV counseling center, or even government organizations. You will find. Yeah. So any other question?
No, sir, that is okay. I understood.
Any other question for group number 5?
Yes, sir. Hello?
Yeah, please go ahead.
Hello, sir.
Yeah, good afternoon, everyone. I am called Jacob Remwako from Uganda. I just want to add something little on what one of the members presented concerning poverty. If we are to see in Africa, well, poverty is one of the biggest challenge, or one of the biggest challenges that many of the African countries are undergoing through. But even if it is the biggest challenge, we see that poverty is not equally distributed. A case in point, you may find in a country, we have urban areas, we have rural areas, we have cities. And if we are to rate the level of poverty in all these three places, they are not equally the same. So it means much as we have the issues of poverty in Africa, it is not equally distributed. Why? Because in urban areas or towns or cities, there are very many activities that actually generate money, and which it helps these family members to support their children in education and good social services, compared to villages or rural areas whereby there are no any other activity that can generate money. Besides, most of them are not educated. So it makes it quite unique that poverty is there, but it's not equally distributed. And secondly, we also see a scenario where we have a lot of natural resources. A case in point, Libya. We find those days before Gaddafi, it used to be a very developed country because of those minerals. There are countries without minerals, and we see that the level of poverty might be very high compared to other countries which has got minerals. So that's briefly what I'd wanted to talk about poverty. Thank you, members.
Thank you.
Questions to the group? Fine. If there are no questions, we can invite group number 6 for their presentation. Our group number 6 members are ready?
Okay, thank you, sir.
Yeah, please.
Hello,
one
sir.
by one.
Sir, good morning.
Good morning. Please go ahead.
My name is Abdusalam Mustafa. I am from Nigeria, and I am the group leader for this group 6. Hello, sir. Hello.
Abdulsalam, just go
Please
ahead.
go ahead, Abdul. I can hear you.
Okay.
Go ahead, we are getting.
Go ahead, we can't be answering.
Okay, sir. So our question is the roles of social worker in the hospital setting. So before I go into the body of our assignment or answer, I would like to make an introduction before I start. So introduction. Social work is a profession in which trained professionals are devoted to helping the vulnerable people and the communities work through challenges they face in everyday life. Then a social worker helps individual, family, and the community gain access to valuable resources so they can achieve their goals. Depending on their speciality, social workers have a variety of responsibility and they can work in different industries such as education, healthcare, and the government. Knowing more about this is our own introduction. Then body of the assignment or the answer. The role of social worker in the hospital setting. A hospital social worker is a professional who support patients and their families in hospitals, communities, clinics, and other healthcare settings by coordinating patient care with the larger medical team. The medical social worker's job is to perform assessment with patient to assess for any physical, mental, or emotional need. They assess the family support system and they link the patient with service to help with the care if needed. Then the psychiatric social worker provide individual, family, and the group social work, counseling, and the other social work treatment intervention to psychiatric hospital patient and the assume primary responsibility for discharge planning. This is a single classification and not currently part of the series of classes. Social worker roles start from the registration of the patient. They perform various roles. Example, liaising with patient and the treatment team, psychosocial assessment, referral, psychotherapy, making discharge plan, follow up and maintain record. The major duties carried out by the medical social worker were case management, data collection, follow-ups, care coordination, health education, financial assessment, and the discounting patient medical fees. The following are role of social worker in the hospital setting. Number one, educating patients and the families about illness and the treatment plan. Number two, conducting psychosocial assessment to identify mental or emotional distress. Number three, counseling those in crisis or experiencing distress. Number four, hospital social worker responsibility include educating patients about various resources at their disposal and interviewing patients to understand their unique needs. Number five, ultimately, will work directly with patients to help them obtain the resources and the support they need to recover from their injuries or illness. Number six, assess each patient uniquely coordination, combining data from medical diagnosis and the personal interview. Number seven, develop comprehensive plan to help patients adjust to medical diagnosis and the transition from the healthcare system to normal life. Number eight, provide necessary support for each person according to health status, personal strength and weakness, emotional state, and the additional factors. Number nine, research local support group and the other resources to determine which one are right for individual person. Number 10, evaluate service and the resources provided to person to determine effectiveness. 11, follow up with patients throughout diagnosis, treatment, and the recovery to determine current state of mental and emotional health. Number 12, maintain current knowledge of local resources and the relevant medical research to provide best possible recommendation to patients. Number 13, excellent communication skill, including ability to explain medical concept to patient in understandable language. Here, I would like to make or to give or to add more explanation about this. You know, in the principle of social worker, there is communication. So as a social worker, or even it is a hospital social worker or industry or other community organization, so you have to be you have to be excellent communication skills, because without communication you can't understand your patient. Then the last one is hospital social worker provide emotional support and counseling for patient by developing personalized plan for patient care. So conclusion, a hospital social worker will work with many professionals like physician to ensure each person receives the medical attention they need. A good hospital social worker must have excellent communication skill, since they need to direct patient to various resources and detail with hospital staff to help patient receive the care they needed. Thank you very much. My name is Abdusalam Mustafa.
Thank you, Mustafa. You presented very well, and I appreciate that you got a lot of social work interventions, including psychotherapy, counseling, all of them. Appreciate for your sincere work.
Thank you very much, sir. So now
Thank you.
the one who shall take over is that Bobby.
Okay, thank you so much, sir, and thank you, Abdul Salam. My name is Bobson Boa from Uganda, and I'm going to present about the role played by social workers in the hospital settings. I hope everyone, you can hear me well.
Yes, yes.
Okay, please. So, first of all, I would like to introduce by with the introductions of social workers, what are the role played by the social workers, and in the introductory part, I would like to place social workers plays an important roles in the hospital settings, and where they work, like they mainly work to provide emotional support, counselings, and advocacies to patients and their families. And you find that social workers, it helps patients to navigate the healthcare system. Like sometimes, you know, when patients come, they get a hard time to get into the hospitals, others have fear, so they help them to navigate into the healthcare system, and they connect them with the community resources available. And sometimes the social workers also help in coordinating cares with other healthcare providers. So this report provides a comprehensive overview of the role of the social workers in the hospital settings. And based on my research, I have 5 points that I would like to present to you about the roles of the social workers. And namely, one is assessing assessing and counseling. So one of the primary roles of the social workers in the hospital is to assess the patient's needs and also provide counselings and emotional support. So this is being social workers providing the patients and their family with a safe and support environment where they can express their fear, concern, and anxiety. So you find that a doctor cannot understand well like patients, what some of the emotional like concerns and anxiety, the fears about the patients. But when a social worker is there, it is easy for him to understand the patient's anxiety, concern, and fears, and thereby getting the details information about the patients. And social worker also works with patients to develop a plan and cares that addresses the physical, emotional, and social need. That is a part of the assessment and counseling. The second point is advocacy. And you find that social workers in the hospital serve as an advocates for patients and their families. So they help patients to understand their rights and responsibility in the healthcare system, and they work to ensure that patients receive appropriate care and services they need during the hospital stay. So that is part of the advocacy, and they also do connect with the community. The third point is connecting with the community resources. Social workers in the hospital also connect patients and their families with community resources and support services. And they can provide information about financial assistance, housing, transportation, and other services that may be available to patients and their families. By connecting patients and their families with these resources, social workers can help to ensure that patients receive the care and support they need to manage their health. The fourth point is collaboration with the healthcare providers. So here the social workers in the hospital work collaboratively with other healthcare professionals, including doctors, nurses, and therapists. So they serve as the license between the patients and healthcare providers and can help to facilitate communication and coordination of care between the patients and the healthcare providers. The last but not least, social workers also do provide end of life care. So here, what do I mean by end of life care? Social workers in the hospital plays a critical role in helping patients and their family cope up with chronic illness, disability, and end of life issues. There are other chronic illness like if you have the heart disease and you have maybe HIV, you having maybe such kind of chronic illness. The social worker can intervene and help the patients to cope up with that kind of illness and in an easy way. So they provide support and counseling to patients and their family during difficult time. And this can help them to make the informed decisions about their health care. So when the social workers intervenes in this kind of chronic illness, yeah, they feel like after the patients can feel like motivated about the kind of the treatment, and yeah, like they help care facilities wherever they are going. This will also help to prevent others from those mental illness and dropping out of their medications. So in conclusion, I don't want to take much of the time. I just want to conclude by saying the social workers played a critical role in the hospital setting by providing emotional support, counseling, advocacy, connecting with the community resources, collaboration with the healthcare providers, and end-of-life care. They are an integral part of the healthcare team, and their contributions are essential in providing comprehensive care to patients and their families. The importance of the roles of the social workers in the hospital cannot be overstated, and their work is essential in ensuring that patients receive the care and support they need to manage their health. Thank you. I hope I was clear.
Thank you, Bobson. You presented very well. Thank you.
Okay, thank you, Babson. Then the next one is Zainab. Is Zainab around? Zainab. Okay, Dantata, just go on.
Okay. Good day to you.
Dantata.
Yes, I'm here.
Okay, thank you.
Good day to you all. My name is Adam Abdullahi. I'm from Nigeria. I'd like to present one role of social worker in hospital setting, which is creating, contributing, fund project, and encouraging blood donors. Healthcare social worker in Nigeria help raise funds in anticipation of indigent patients. They do those three writing to high-profile person in the state, influencing multinationals to utilize such means as their corporate social responsibility and partnering with NGOs. These rice funds are monitored and accounted for their use at necessary time so assist indigent patients. Most social workers in Nigeria are sometimes used as public relation personnel. They sensitize the public to participate in blood donation and as well often them moral support while in the process. Other areas of interest and responsibility of healthcare social worker in Nigeria include public sensitization towards health, HIV/AIDS and other related disease campaign, supervision, generalists, practitioners, social worker on field work practice, and internship at health facility, communication of policy and practice of the medical facility to patient and their support network, recommendation of policies and practices to the facility management. They will enhance the well-being of patients, participate in ward round to ascertain psychosocial condition of patients, and exchange idea with other professionals. Thank you. This is my presentation.
Thank you, Abdullah. Yeah, next person, please.
Abdul Salam, go on with the next person.
Hello, are there?
Abdul Salam, how are you?
Hello.
Yeah, go ahead.
Dante, have you done?
Yes, I have done. I have done.
Okay, then Zainab. When Zainab, she is not around. Then Joanne, are you around? Joanne. Joanne, Farooq, Afrin. Farooq Afrin. Please, class, if there are someone from the group 6, then please walk out to present, please. Hi.
Yeah, audible, Abdul Salam.
Okay.
Please go ahead.
Please anyone from group 6. Sir, please, we are very sorry. Zainab, she is coming now.
Yeah, sure.
Hello, Zainab, have you ready? Farooq Afrin or Joanne? Sir, please, we are very sorry. And in 1 minute, when she is coming now, sir, and I have called her.
Okay, okay, no issue.
So I think instead to be waiting for them, I have some two questions here regarding to their representation.
ಗೌಡ ನಂಜೇಗೌಡ ಇದ್ದರು ಅದು ಬೇಕಾದ ದಾಖಲೆಗಳು ನನ್ನ ಬಳಿ ಇದೆ ನ್ಯಾಯಾಲಯಕ್ಕೆ ಅದನ್ನು ಕೊಡ್ತೇನೆ ಉರಿಗೌಡ ನಂಜೇಗೌಡ
Ahmad Buba, please let us finish our presentation. Please don't confuse us. It is the general problem. We know. I suggested you that we have to finish our presentation, then to talk about that issue, please. Thank you for understanding.
Hello.
Yes, sir.
Hello, sir. Let us continue before they come.
Yes, sir.
Fine. So we will have a discussion. Let them when they are ready, we can give them opportunity.
Now.
Hello. Yeah.
Yes, sir. So I think I would like to have this meeting opportunity to ask some questions regarding.
Yeah, please go ahead. See,
yeah, my
today is the last class of fieldwork practicum semester 2. So I would like to ask all the participants, all the learners, to ask your clarifications question related to fieldwork practicum, especially journal 105. Yeah, please go ahead, Faisal.
Yeah, my first question regarding to their presentation is how can a involve in hospital settings?
Pardon, can you just repeat as your voice was breaking?
How can a social worker get involved?
Yeah, very good. It's a very good question Mr. Faisal has asked me. So I would like to answer this question. So I request everyone to give attention.
After
question dear students, the social work profession is a very vast and it is a professional program and it has got its own scope in all the fields. Now, one of our friend, Mr. Faisal Abdullah, he has asked, how can we initiate or how can we work in hospital setting? See, social work, the Bachelor of Social Work online program, what you're studying now, and it has got components of industrial setting, hospital setting, NGO setting, community setting, and even other settings. So where you can practice social work. So now, as far as hospital setting is concerned, you have a different health issues in health disorders, health sectors in hospital setting itself. For example, if I take some of the health issues of African continent, for example, malaria is there, cholera is there, HIV is there, Ebola is there. Even you may also find COVID during COVID time, COVID health issues also there, and you can take any other health issues. Malnourishment is there, women health issues are there, children issues are there, mental health, of course, mental health issues are there. In that, addiction issues are there. So as a social worker, you can join any center as a social worker. Many times there may not be position as social worker. You can also join as counselor. You can also join as a welfare officer. You can also join as case worker. You can also join as researcher. You can also join as for example liaison officer. You can also join there as public relations officer. So all these are all different terminologies, different names for social worker where you can use or where you can work in hospital settings. Uh, so whenever you get a chance to work with different health professionals, you can tell them that you are trained in the health. So you can the social work methods including case work, group work, community organization, health administration, and even case work research. They're all very effective methods You can work with different stakeholders. You can counsel individual patients. You can counsel their family members. You can help them to find out to resolve their issues. You can work in a team. You can bridge between the doctor and the patient, doctor and family members. You can communicate the whatever the message that doctors are giving. That's like psychoeducation. You can probably you can also call for people with a different illness, and you can conduct a group meeting, group work. You can through different of course you will study group work, casework very extensively now, and all those things you should practice with them. Is this fine, Mr. Faisal?
Yeah, it's fine. Then my second question is there any difference between the line, please? Is
My
that any difference?
voice is
Is that
breaking.
yeah? Is that any difference between uh, the social worker profession and the sociological profession,
Of
sociology
course,
profession?
yeah, of course, you are right. There is a lot of difference. Sociology is not a profession. It is like any other subject, whereas social work is a profession. See, how do you differentiate from social work and sociology, or how do you differentiate from professional, intervention, non-professional? See, there are certain criterias. The first one, to be called as profession, you need to have your own code of conduct. You need to have your own set of rules and regulations. You need to have your own standards. You need to have your own value system. You need to have your own interventions. So here in the professional social work, you have social work methods, social work objectives, the principles, the techniques, and the skills are there. The methods, very importantly, the methods are there, and the counseling techniques are there. So all of them, and you have a value system. You have a professional forums. You have a regulations. Sometimes even many countries you need to take a license. For example, in Africa you need to take in America and Japan, developed countries, you need to take a license to be to be called as a social worker and to practice in the community. So all of them are completely different than sociology, right?
Hello, sir.
Yeah.
Hello, sir. I have something to add regarding to his first question, which he said that how a person should become a social worker in the hospital.
Yeah, please go ahead.
Sir, there is in my own investigation there is 5 steps to become a medical social worker or hospital social worker. The first step is complete a bachelor degree in social work or related fields. Then number two, pursue a master degree in social work. Then number three, complete a field work power requirement. Then number four, become licensed. Then number five, maintain licensure. So medical social workers need to complete bachelor degrees in social work, sociology or psychology, a master degree in social work, and that is only something that I want to add. Thank you, sir.
Okay, good.
Hello, sir. I have question.
Yeah, please
Hello,
go
sir.
ahead. Please go ahead.
Okay, okay, sir. How does a social worker play a role in in psychiatric hospital setting?
Pardon?
Yes, I said, how does a social worker play a role in psychiatric hospital setting?
Yeah. See, one of our
Hello, sir.
presenter presented very nicely. To be called as, there are, see, bachelor of social work is a very basic degree. Okay, you will have very minimal exposure. You will have very minimal exposure for mental health or psychiatric social work intervention. But however, if you want to be called as a social psychiatric social worker, you can, after this degree, you can also go for master degree. In that, you will have specialization as medical social work or psychiatric social work. But in as far as this bachelor of social work is concerned, when you do field work, you can also select for addiction centers, de-addiction centers, rehab centers, mental health centers, or even psychiatric centers. There you can practice group work, casework, community organization with your patients and family members, or even community. So for all those things, you need to read what is all the social work methods. You need to read the social work interventions. You need to read alcohol interventions, mental health interventions, psychotherapy. All of them will come, but these are all a little bit superior interventions. But over a period of time, you will get to know the interventions of psychosocial worker, psychosocial interventions, assessment. All of them will come, but some of them may be also part of this bachelor degree. Over a period of time, you will learn.
Okay, thank you, sir.
Hello, sir.
Yeah, please go ahead.
Sir, my group members or my colleagues members of this group says they complain with me now at WhatsApp. They say that they are facing network problem, but they are coming. So I would use this opportunity to add something about regarding to the question of Alu Sabo.
Yes, please go ahead.
Sir, like he made mention that how the social worker shall work in psychiatry. So, like us, we as a student of social worker, social work. So when we should go to the or to work in the psychiatric, so we should be able to work together with those that are professional in psychiatry. What I am trying to say here is that those that are doctors in psychiatric, so we should keep looking what they are doing or what they are try to combine those that have that problems. This is only what I can answer. Thank you.
Yeah, thank you. Next question.
Hello, sir. The Zainab is on now. Let her present.
Yeah, please.
Okay, Zainab, please go on.
Okay. Good morning, sir. Hello. Hello.
Yeah, please go ahead. Yes, you are audible. Zainab, please go ahead.
Hello. Good morning, sir.
Zainab, go ahead. Go ahead.
Presenter of social work. I will present role of social worker in I will present roles of social worker in the hospital. Social worker in hospital necessarily work alongside other health care professionals and other relevant healthcare professions. And the interpretation of social work held by doctors and nurses are appropriate both to their relationship with social worker and to the smooth running with social workers and the smooth running of the hospital. Hello? Medical.
Yeah, please go ahead. You are audible.
Social worker is a sub-discipline of social work, also known as hospital social work. Medical social worker typically involve in a hospital, skilled nurses, facilities, or hospice have a graduate degree in the field and work with patients and their families in need of social help. Social. Yes? Yes, sir. Are you hello, sir?
Yeah, you go ahead. Yeah, please go ahead. Please go ahead, Jainab. You are audible.
Hello.
Can somebody tell us? Go ahead, please.
Zainab, Zainab, your network I think is bad.
In need of
Continue. We are
psychosocial help. Medical social worker assess the physiological functioning of patients and families and intervene as necessary. Intervention may include the following: connecting patients and families to necessary resources and support, providing psychotherapy, supportive counseling. Hello? Supporting. Okay. We have the following necessary. Hello? Hello?
She is audible.
Zainab, continue.
She is
We
audible.
can hear you.
Please ask her to continue. You are clear. Go ahead.
Yes, yes.
Hello? Hello?
Zainab, continue. We can hear you. Continue, Zainab. We can hear you. Zainab, continue. So I think the network for Zainab, I think is very bad.
Yes, I understand. So, we can, probably we can tell her that, there is a network issue. Now we'll continue question answer session. So, are there any questions from the floor? Yeah, Buba, please go ahead.
Hello, sir.
Go ahead, please.
Yes, and social worker.
Yeah.
Hello, sir.
Very good question you asked.
Yes,
Social worker is a very, social worker is a very general terminology. Case worker is very specific, role. For example, in the social work, a social worker has to do all six, perform all six methods. Whereas case worker will practice only social case work. That is one of the social work method. Right?
Okay, thank you, sir. Thank you so much.
Next question, please. Yeah, please go ahead. Rebecca. Rebecca, please go ahead.
Rebecca, if you're audible, you can go ahead.
Now I wanted to ask you, how many of you started field work?
Yes, sir, we started to. Hello, sir.
Yes. Yeah, Buba, you started?
Yes, sir. Okay, sir, we started to. Even me, I already done my own field work because I just go and visit some organizations in my community without providing them a introductions later. So I just told them that I have some fieldwork assignment orientation with the NGOs is assigned to me by my school. So now our time of assignment is only closely to just for the deadline of our submission of assignment. So I just go and meet them. They allowed me to see their program manager. Some organization they allowed me to see their program coordinator. So I just told them that I want to start some orientation with them.
Very good. See, that itself is a orientation visit. So that you can write in the journal.
Yes, I already write it. I already write it down. I finished all the orientation with the 20 organization. But the thing that I just want to know now. My question is that the case of supervisor. So as you say, we should find someone who have a BSc in social work. But it's very hard to get someone who have
No
a BSc
issues.
in social
Yeah, I understand, Mr. Buba. Don't worry. Don't worry. For time being, you will have to prepare for the exam. Okay, so whatever you heard from all these classes, you take that as guide and you practice it. And we also uploaded guidelines on LMS. There is separate guidelines for fieldwork practicum. So you just download that and practice. See, it is all self-learning material. You can do it for time being. You can manage this, and we will also see how best we can help you out with all the things. And now letter you asked. So our director, Dr. Tripathi sir, he said he will give the letter, and those who want letter, he also given the his email ID. I mean the email ID exclusively kept for BSW program. So kindly email it to him, and he will give a letter. And meanwhile, those who not required a letter, so continue field work. Those who not started, kindly start it, and finish first semester field work practicum. Once you finish first work, start second semester. So don't wait for the last minute. Hope I make
Okay,
sense.
thank you. Okay, thank you, sir. But so now what I want to know, without providing the fieldwork supervisor, I can't just submit my assignment when I finish all the
No, no, yeah,
fieldwork
yeah,
visit.
yeah, I got your point. But whatever you write, first do 20 visits. No, for first semester, 20 visits, you do it and write the same thing in the journal, right?
Yes.
And whatever the class happened, that also write it as induction meeting and fieldwork supervisor. You write our names, faculty names here. For time being, you can write these things. So we will see how best. We'll also talk to concerned authorities to provide you fieldwork supervisor. But for that, it will, since it is an international program, Ministry of Indian government and your country is also involved. So we will talk to our university admins as well how best we can provide you. But meanwhile, visit all the agencies, write their report in the journal and submit, and also complete your assignments, get read our LMS materials, get ready for the exam.
Okay, thank you, sir.
Yeah.
Sir,
Yes, Chunga, please go ahead.
sir, I did write a letter to the director. He sent us the email address, but he has not responded to our emails, and we have not even received letters. But we wrote him last week. So wonder whether that can be provided or not. Because in some countries like Malawi, most NGOs are so strict, and they need to see who is really getting the information from them.
See, you should now you should tell them that I am a student of a BSW program that is doing from India, and I want to understand what activities you're doing. This basically for educational purpose, not for any other things. You need to sensitize them. If that organization is supporting, then you will have to look for another organization.
Yeah, of course, we usually tell them when we go there, but not every NGO can understand that,
I got
Yeah,
your
but
point, but what to do? So you will have to know. I mean, if that is not in your area, probably you'll have to go for another area, another locality. And now another thing, there are several friends in your in a country, Malawi. So why don't you make your own group, and why don't you start field work together?
yeah,
Yes.
Malawi as per se, it's not a small country as it might be seen on the map. It's also a big country. So meeting each other is not an easy thing because we are living in distant districts, and it's not easy to meet. It requires, transportation,
No, what I'm trying to say
some can
is you can
sleep
have a
over, all of those
separate,
things.
yeah, Chunga. What I'm trying to say is you can have a separate WhatsApp group for your country people, just like you're having for other groups. So try to exchange the knowledge, try to exchange the organizations. So if you talk to one organization, they may be having branches in other area. So like that, you can search for the organizations and do the field work. And there are several government organizations, right? You can also visit a government school, government hospital, non-governmental organizations, youth organizations, charitable organizations, even religious centers. All of them are kind of fieldwork placement centers.
Okay, thank you.
Sometimes you will have to travel. See, many times writing email may not be suitable. If you, the organizations nearby in your place, so try to visit that organization, talk to the concerned authority, tell them you are a student of Bachelor of Online Social Work program. You want to visit for this organization to understand the nature of work, and tell them this is a part of our degree.
Hello,
Okay,
sir.
thank you. Thank you.
Yes, Mustafa.
Sir, I have a question regarding to the examination. Sir, please, our examination, when are we going to write our first semester examination? And is it online or offline examination? Thank you.
See, Mr. Mustafa, as far as my knowledge is concerned, I don't know when is the exam. That for that, Director Bhuneshwar RC has to inform you. Sir is there now. I think he will answer. Second one, you can also write a mail to our BSW email ID. That RC Bhuneshwar will respond to you. So probably very soon they may conduct, but date and all I don't know. But my suggestion is keep submitting your assignments, keep ready for the exam. Once you are ready, whenever it comes, probably they'll do it. Don't worry about the dates and all. But I think very soon they may conduct. So exam may be online. So I'm not sure, but it may be online. But the university will inform you regarding the rules and regulations and the mode of exam, all those things.
Thank you.
Yeah.
Sir, I have a question. My question is regarding the field. For example, now in locality, I have only one, but the supervisor he then used to he's busy man actually. So
Yeah,
I
please
don't
go
know
ahead.
how should I do this issue, sir. Can I submit it that he is assigning or supervising me? How can I do?
Sorry, can you repeat as your voice is breaking?
I said in my locality, I got one supervisor, but unfortunately, the man is a busy man. He don't used to stay. He always traveling. So I don't know now how should I do. I even start, doing my fieldwork practicum. I almost close to an end
But there
without.
are there are other members in the organization. So why don't you meet the other members?
Yeah, I have many organizations in my locality. I have.
Yeah, so you do it one by one. So whoever gives first permission, you do finish that.
Okay, okay,
So at a time, you explore many organizations. Whoever gives permission, you just do that.
okay, okay, sir.
Hello, sir.
Yeah, go ahead.
Sir, in my area, there is one lecturer who is teaching some course which is called social service and social change, and he is sending a lot of his students to go to the different organization like even hospital, prison, etc., in order to give something to the helpless. So, sir, I don't know. I know that he has a PhD, but I don't know whether he was studied social work. I don't know, but I have 100% that he is teaching or he is lecturing the student in the Federal College of Education. He is teaching some course which is called social service and social change. So, sir, can I request him to be my supervisor? Thank
See,
you.
Mustafa, I wanted to ask you one thing. He or she should be a social worker. At least minimum graduation they should hold to be qualified. To be called as professional social worker or field work supervisor. So you just ask him whether he has got a degree in social work. Otherwise, you'll have to look for other person. So I cannot, teach you unprofessional things. So I want to tell you who can supervise you. So what is their qualification? What is their experience? So a social worker holding minimum graduation can supervise you. If the person is not there, then you'll have to identify other person.
Thank you very much,
Then
sir.
my question is, what if the entire organization there is no someone who is qualified with a bachelor's degree or master's in social work?
Yeah,
So
very
what
good.
can we
Very good
do?
question. Very good question you asked. Probably someone else from you can visit that organization, you can study, but someone else from some other social work from different organization can supervise you.
Okay, thank you, sir.
Yeah. So like that, you can others also Mustafa also can identify. There may be other person from different organization. He can supervise for entire your semester. There's no issue. We wanted a person from social work background who can teach you proper professional social work interventions are the profession.
Okay, thank you, sir.
Yeah. Any other questions?
Yes, there are colleagues who are struggling. They haven't been present with us during this exercise of presentation. So
They
they
want to
are
present now?
requesting so that you can give them the groups, the
Yes, yes.
likes of Rebecca.
Yeah, please go ahead, Rebecca.
Hello.
Yes, Mustafa. So ask them to go ahead.
She's
Hello,
requesting to
Rebecca.
be given the group. She has no group.
If she has
Okay,
the topic, she can go ahead if she has prepared.
yes, already last week the lecturer made mention that anyone who does not have any group so should join the group 6. Rebecca, please go ahead. Rebecca. Baita, please inform her that we are waiting her, please.
But today she's not set. She has no idea about the question. What I know, but she's having maybe the network problem.
That's
She
okay.
she
That's
has
okay.
just tried to type to
Yeah.
me.
Yeah, that's okay. So tell her that she can present next semester. So there will be opportunity.
Okay.
Okay. So now we'll continue this class. Any questions related to fieldwork practicum, especially for 105 BSW second semester? And there is a question somebody has written in the chat box. What if you have failed to get a supervisor who has done social work? So what I'm trying to say is, if you don't find out in one organization, find out from different organization. One person is enough to supervise entire field work for first semester or second semester. The same person also can act as a supervisor for second semester. For example, somebody has asked, Malawi is very big country, so you don't get. So not necessarily that you should travel to supervisor. He or she can supervise you through internet, through telephone, through even Google Meet, different social social medias. He can tell you that what exactly you have to do it in the fieldwork agency, so that you can do it. Hope I'm making sense here.
Yes, sir. Yes.
Yeah. Any other questions?
Hello, sir.
Yes, Jimba.
I understand the Blackcam 104 was we were able to edit on it, right?
Yeah, go ahead.
But it's different from Platinum 105. It's
Yes,
just a
it is different. We will upload. Yeah, it is different. It is different. First, I wanted you to finish first semester, then you can go
or
to second semester.
which means it will be also editable, right?
Yes, I will give.
Okay, fine. I'm fine then.
But I wanted you to share whatever I share with you to all the people.
I already shared with them. Some send their emails. I send them to their emails. Some and I even send to the chat WhatsApp group.
See, Miss,
I think everything is
yeah,
okay.
Miss Jimba, I understand you have a WhatsApp group for all the students. Do you have it?
Yes.
If you have it, why don't you share in the WhatsApp group as well so that people can see?
I also shared it with them there.
Yeah, so then don't worry. If they're not getting a mail, then it will be there in the WhatsApp. No, same thing, they can use it,
Yeah.
isn't it? And in case if any person is unable to get from LMS, you have my email ID, right? So why don't you mail? So same thing done by Miss Jimba. She has mailed me, and I sent to her. Same thing. My first suggestion is go to LMS with your credentials, log in LMS so that you can see your courses. You can download your the materials, assignment papers, the fieldwork journals. You can also see the announcements. You can upload back to LMS. There itself you can see your evaluation. Everything you can do that. But on top of that, you are unable to get that. So you can mail me.
Yeah, sir. For example, for me now, I don't have your email actually because
I am typing now.
Okay, okay, sir.
My email ID is there in the LMS, no? It is there in the program guide. It is there in the website. It is there in LMS as well. Anyway, I am typing now. Yeah, so my email ID is I have typed now. I will type my name as well.
Okay, sir.
Hope you can see that. Yes, Rebecca, you have raised hand, and Chunga also you raised. So go ahead. Hello, students are there?
Yes, sir.
Yeah.
Yes, sir.
See, I wanted you to read social work, first semester, second semester materials as well. So kindly read that. The field work you will have to start. So, first semester you finish, then start second semester.
Okay, sir. So, sir, I have questions, sir. I think it's only 4 days remain to our deadline of first semester fieldwork submissions. So I don't think that some of our students or some of my colleagues, they have not done the fieldwork practicums because of lack of the NGOs in their
That's
local
fine.
area.
Yeah, so Buba, that's fine. I know what you can do. If you're not able to do it now, you can do it. All first semester, second semester, third semester, you can do it. Next semester. So, not necessarily that you should do it now because of time constraint, practical, different practical reasons. But now whatever you do it, you submit, or whatever you. I mean, I wanted you to submit assignments first, then field work, whatever you can, you do it. If you're not able to do it in this semester, at least both the semester combined together, you can do it in next semester. Now you are aware about all the things, right? So you prepare well in advance. You contact organizations in your locality or even other locality. You have a friends list. You have a colleagues from across Africa, so talk to them. Establish your strong network, so you can do it. So don't worry. So you have you have all the options.
Hello, sir.
Yes, Mustafa.
Sir, I'm very sorry. I have a little question regarding to the field of work. Sir, are we only going to write down the name of that organization, or we should add more about that respective organization?
See, not just writing the name, you will have to write there. There is a report, no? There is space. First, writing the name and address, and you'll have to write, what activities they are doing it, what is their objective, what is their when the organization got started. So some simple history also you will have to write, and what are things you have observed overall, their stakeholders, all of them you will have to write.
Okay, thank you, sir.
Yeah.
Sir, please, are we going to type it or to write down it on paper, then to upload it?
Yes, you will have to type. You will have to type the PDF journal is there. You will have to type in the journal, and save it. Once 25 visits are over, you can upload.
Thank you very much, sir.
Yeah.
Go ahead.
So I
Hello.
request, yes, I request RC Director Bhuvaneshwar, Dr. Tripathi sir, to say few words.
Okay.
So I've sent a question in the type and the chat.
Thank you.
Can you respond,
Thank you
please?
very much, Dr. Sethi.
Yes, sir.
I could not attend today's session because of so many other engagements.
No issue, sir. I can understand.
But anyway, I am very happy that our learners from Africa are keenly attending the sessions, and I am getting positive feedback from every one of them. I'm also, from time to time looking at the emails sent by our learners, and I'm trying to send suitable replies to them. Through this platform, I would like to request all the participants, all the learners, to kindly see the IGNOU's website periodically, because in the LMS portal, all relevant informations are provided by the university headquarters, by our school faculties, by our academic counselors, and also by Regional Center Bhubaneswar. In case of any difficulty, you can send emails also. I have already given the email ID to all of you. So please send emails in that email ID, so that I can straight away see and send the replies to all of you. And this is just the beginning. Your activities will start after the counseling session, because today is the last date of the theory counseling sessions. The practical is the real work that you have to do at your respective places. Please do as directed by our faculty, school faculty, Dr. Kanappa Setti, Dr. Lingaswamy, and other school other academic counselors. After completion of the first year courses, we will be switching over to the second year, and then third year. Accordingly, we'll go ahead. But your successful completion is our motto. We want that you all should successfully complete the program, because IGNOU is, as all of you know, IGNOU is the largest open university in the world at the moment, and its objective is to provide cost-effective vocational, professional, and skill development programs to all the needy people of the world, whole world. And therefore, in many overseas countries, IGNOU has set up study centers, and not only the people of India are benefiting, but also the people of the international community are also taking ample benefit of the programs launched by this university. So you are really fortunate that you got associated with our programs, and maybe after BSW, you might like to join some other programs which might help you in building your academic career. So that way, we are also very keenly waiting for the response from all of you. And this is something which is very satisfying, that you all have joined this BSW. We have been entrusted with the responsibility of one more program, that is BTS, Bachelor's in Tourism Studies. So the counseling classes for the first year of that course is also over. And now the learners will be busy in writing their assignments. So I would request all of you to also download the assignment questions from IGNOU's website and start writing the assignments. Once you complete the assignment answers, please upload them in the LMS portal, and that will be properly evaluated by our counselors. So I'm very happy that you are there, and in case of any difficulty, you can straightaway ask us through email or through any other means of communication that you have with you. And I think, and I must thank our school faculty, especially Dr. Kanappa Sethi and Dr. Lingaswamy, who have very keenly and very meticulously provided guidance to all of you as to how you will go about in your practicum, in your practical activities in BSW. So, at times I used to listen to the presentations, so it was very fruitful. And I must thank both of them, because they are young and they are very experienced people. They're very experienced, and it is good that they're associated, and we would definitely need their support in our future classes also. And definitely after the end of today's sessions, I will be sending a detailed report to our university headquarters as to how many classes that we have conducted and how many participants have attended and all that. So that is a different issue altogether. But one satisfying thing is that you all have successfully participated, and that with interest. So I'm very happy. So this much I would like to share with you, and thank you very much.
Sir, I would like to say the concluding remark from my end.
Please go ahead.
Last 5 classes for almost exactly 10 hours we have done with this wonderful students from different countries of Africa. I must say, after seeing their participation and their presentation and their knowledge, extremely good. Though you, as you said, that we are doing this program with different countries, and we have students from across the world, and our strength is current strength is 35 lakh plus. But this particular batch, e-Vidya Bharati project, this particular students are extremely knowledgeable, and they are very interesting students, and they prepare the topics like anything. They've gone in depth of all the subject. For example, this is Bachelor of Social Work degree, is a very basic degree, but they've gone to super specialty of all social work, the degrees. So I'm extremely happy with their presentation. I'm sure with this degree, they will get into master degree and even PhD. So that much capacity, the language expertise, the interest what they are showing, extremely happiness for me as well as my colleagues. I'm sure the university is also very will be very happy after seeing their participation and their involvement. So I wish them all the best. And as you said, we are there. I have given my email ID, and our RC Bhuneshwar contact number is the contact email ID is also there with them. So anytime for anything they can mail it to us, and we are there to support them. So I wanted to thank you thank you, sir, for giving me opportunity, and I should thank all the participants here for their sincere efforts and active participation. All the best for your exam and your practicum, practicum as well.
Thank you so much.
Thank you, and thank you very much, sir. God bless Nigeria. God bless India. Go ahead.
Thank you. God bless all of you, and wish you all the best.
Thank you.
Thank you, sir.
So we'll be again meeting.
Can we answer the question that we type before we
We'll
go?
be again meeting for the second year sessions after a few days, isn't it? So that is because your BSW.
Thank you.
As I said, I wanted to ask about.
Sir,
Thank you, sir. Thank you,
when
sir.
are we going to visit IGNOU?
Probably. Anytime you can visit. Anytime you can visit. And India welcomes you. And India is always supporting. All the countries. We see our motto is Vasudhaiva Kutumbakam. So that means we are all part of one family.
Thank you very much, sir. We are so proud to be part of the student for this beautiful university in the world. Thank you.
Over you, sir.
Thank you, sir.
Thank you, sir. Thank you.
Okay. Okay, thank you very much.
Namaste, sir.
Namaste. So
Namaste,
do well,
namaste.
do well. I could only say you're all very potential students.
Thank
You got a
you
lot of
from
interest, you got a
Malawi.
lot of knowledge. Do well. Sincere efforts will always give you good efforts. I mean, good results. So I'm sure many of you may get into master degree, that is MSW. After that, you can also do a PhD. There are a lot of opportunities from IGNO, even different universities. I'm sure you can emerge as a good social work career. I mean, this social work is professional. So do well with your sincere efforts. You can get good results. All the best.
All the best, sir. We wish you all the best. We wish both of you all the best. Thank you.
So thank you. Bye.
Bye bye. Bye bye, sir.
Thank you, sir.
Thank you, sir.
God bless.